Welcome to Harder-Miel Dental Clinic. My name is Sönke Harder, and in this presentation I'm going to talk about computer-navigated implantology. The basic requirements for the application of navigated implantology is the presence of a three-dimensional X-ray image, a so-called cone beam computed tomography. In contrast to a two-dimensional X-ray image, it is possible to assess very exactly the extent of bone which is present at the planned implant site, and to decide whether bone grafting is necessary or not. The main advantage about navigated implantology is that we have the possibility to plan our surgical procedure virtually at a computer. As you can see in this picture, we have implants placed in the present bone, and if you have a view at the right upper picture, we can decide right now that there is not enough bony support for our implants and that we have to plan our sinus floor elevation procedure at this moment. And it is also possible to transfer the virtual implant position in a template, and by this template in the clinical reality. Now we can have a look at a clinical case. As we can see here, in the lower jaw there's a desperate dentition, the upper jaw is edentulous. This patient asks for an implant-supported fixed restoration. In the first step we have our 3D X-ray image. We place our virtual implants, and in the next step we can have an idea about how is the soft gum situation with regard to our implant position. And this is done by scanning a cast of the intraoral situation, matching it with a 3D X-ray image. And after that we can match also our imagination about how the new teeth will look like. So this is a setup, it's also scanned and is matched with the cast of the edentulous situation and the 3D X-ray image. Putting all this information together, we are now able to create a surgical template. This kind of template enables us to transfer our virtually planned implant position in the reality. So this template will guide our implant drill right at the defined position of the implants. In favorable terms, what means in this situation that we have enough amount of bone at the planned implant site, we can place implants just without cutting the soft tissue, but having only a small punch in this area where we want to place our implant. For the patient, that means that he has the advantage of being nearly painless and without any kind of swelling immediately post-operative. The next image shows the situation immediately after having placed all 4 implants in the upper jaw through the surgical template. And in the post-operative X-ray image we can see that we achieved a very exact implant position. The terminal implants are placed in an angulated way to avoid any kind of contact to the sinus in the upper jaw and to a facial nerve in the lower jaw. Having a very exact implant position with regard to the definite restoration, it is very easy for the dental technician to finalize this restoration. Here in the last X-ray image we can see we have 2 screw-retained bridges in the upper and the lower jaw, and the intraoral situation looks very nice and aesthetic. So even the last picture showing the smile of the patient is very satisfying.